So today we will be talking about wounds and how to clean the wounds. So the first one that we will be talking about is a nosebleed. For a nosebleed, you will use these nose plugs, and you kind of bend them and shove them in the nose. You do not pull it out until you can tell that there's fully blood in it, and it's
Usually there's like basically an end point. It's
yeah.
a booger or something.
Yeah, it'll be like a big blood booger. Pretty nasty. Then we also have second skin. It's like these gel things. They stick everywhere. You peel off the blue part and the plastic, and it's helps with a blister or a burn.
You usually put it on right before you put a Band-Aid or a wrap on around the blistered area.
It doesn't get more injured.
Or pop.
Yeah, that too. So next we will talk about steri strips. Steri strips are these strips that help hold together a wound, usually a puncture wound or something on that order. They're just these strips that you can see your arm. So say she has a wound right here, I kind of put it together and put it there.
It's pretty good for head wounds and stuff.
Yeah,
Because you can't put a Band-Aid on a head.
yeah. So the way you would clean a wound is, so when you're cleaning a wound, first you want to make sure you have gloves on. If you get blood, you don't know what kind of diseases, if the person has a disease or what the person might have. So you'll always want to put gloves on first. And then if they're bleeding out or anything, you're going to want to take some non-sterile gauze. Non-sterile meaning that it's not sterilized and it's whatever. You'll put direct pressure on the wound so it will stop the bleeding. The purpose is to stop the bleeding. And then you'll have to treat the wound for what it is. So if it's a puncture, an incision, just depending on what it is, and if you have to call 911. And then if you call 911, you let them know what's going on, and you let them know like the normal routine for 911. And then that's when you also realize if you need steri strips or not. And then the purpose, or how you clean the wound is you'll use soap and water, or you can use this stuff. It's kind of like soap and water, but it cleans the wound.
And it doesn't hurt you.
Yeah. You'll use sterile gauze. So after you use non-sterile gauze to put pressure, you will use sterile, which is this stuff, and it helps.
It's basically so that
the wound doesn't get infected. And like you don't want to use non-sterile gauze on a clean wound after you do it. And then you'll want to, after that, you want to cover it with the correct products. So a lot of times we will use Tefla
for scrapes. Sometimes we use it for staph infection areas.
Yeah, it's just kind of this gauze, and it has this plastic piece over it. It's so it doesn't get stuck to the wound
And rip the
blood clot or whatever scab or whatever's on it already. And then it just is easier. And then when you're removing the material, so say that this is covered in blood, you'll put this in your hand and you'll take your glove off with it in your hand, and everything will be in the glove, so you don't have to touch it. And then you want to put it in a biohazard bag, just for safety cautions. It's just easier for it to be taken care of.
There you go.
All right, this is Blood Stop.
And you use it for minor wounds and abrasions.
You'll take the cardboard piece off. You flip it around and you push it down until that goes down here, and it stops the blood. But you don't want to use it on a big wound because it's not big enough to stop the blood. Thanks for watching.